Have you ever woken up in the morning and felt like your joints are bound by chains? Or perhaps you've noticed that after a regular walk, your knees start to hurt and swell. These symptoms could be early signs of arthritis, and ignoring them could lead to serious problems in the future. Today, we will talk about how to recognize arthritis in its early stages and which symptoms should alert you. Arthritis is a condition that can significantly reduce your quality of life if not addressed in time. However, if you know what to look for, you can significantly slow its progression and maintain activity for many years. You will learn about 10 early symptoms of arthritis that can help you determine if you need to see a doctor. We will examine each symptom in detail, based on scientific research and opinions from leading specialists in rheumatology. You will learn which signs can be early warnings of the disease, and why it is important not to delay a visit to the doctor. Have you ever wondered why some people can maintain mobility and activity into old age, while others suffer from joint pain? The secret lies in early diagnosis and the right approach to treatment, and we will help you understand this issue. If you want to know more about how to take care of your joints and prevent arthritis, subscribe to our channel. Let's start our discussion with what arthritis is and why it can be so insidious. Arthritis is a general term for over 100 different diseases that cause joint inflammation. It can lead to pain, swelling, stiffness, and loss of joint function. The most common types of arthritis are osteoarthritis and rheumatoid arthritis. Osteoarthritis often develops with age as joints wear out, and the cartilage that protects bones breaks down. Rheumatoid arthritis, on the other hand, is an autoimmune disease where the immune system attacks the body's own tissues, causing inflammation and joint damage. Regardless of the type of arthritis, early diagnosis plays a key role in successful treatment. The sooner you start treatment, the better the results, and the more likely you are to maintain an active lifestyle. So let's move on to the 10 early symptoms of arthritis. Joint pain is one of the first and most common symptoms of arthritis. Pain can range from mild to severe, and usually worsens after physical activity or prolonged sitting. A study published in the journal Arthritis Care and Research showed that about 60% of people with early stages of osteoarthritis experience joint pain after activity. Pain can manifest differently depending on the type of arthritis and its progression. Dull pain usually accompanies chronic forms of arthritis, such as osteoarthritis. It can be constant and debilitating, worsening the quality of life. Dull pain often worsens with movement or physical activity, and at the end of the day, sharp pain is characteristic of inflammatory forms of arthritis, such as rheumatoid arthritis or gout. It often occurs suddenly and can be very intense, forcing the patient to stop any activity. Throbbing pain can indicate inflammation and swelling in the joint. It is often accompanied by a feeling of warmth and redness of the skin around the joint. Burning or stabbing pain may indicate nerve or soft tissue damage around the joint, which is common in osteoarthritis and other degenerative joint diseases. A feeling of stiffness in the joints in the morning that lasts more than 30 minutes is also a sign of arthritis. Dr. Jonathan Kroger, a rheumatology specialist, points out that morning stiffness is an important symptom that should not be ignored. A study by the National Institutes of Health found that about 50% of patients with rheumatoid arthritis experience significant morning stiffness. Patients often describe this condition as a feeling of frozen joints that gradually loosen up after starting to move. Some patients note that it takes about an hour each morning to restore mobility to their fingers after waking up. Joint inflammation can cause swelling and redness in the affected areas. A study published in the journal Arthritis Research and Therapy confirms that this is one of the key early symptoms. Inflammation causes fluid to accumulate in the joint, leading to its enlargement and skin color change. Swelling can be particularly noticeable in the small joints of the hands and feet. Dr. Linda Craig, a rheumatologist, notes that patients with rheumatoid arthritis often complain of swelling that can interfere with wearing rings or shoes. According to studies, up to 80% of patients with rheumatoid arthritis experience joint swelling in the early stages of the disease. Gradual limitation of joint mobility can indicate the development of arthritis. Dr. Amy Myers writes about this in an article for the Mayo Clinic. Limitation of range of motion can be caused by inflammation, pain, and swelling that prevent normal joint function. This condition can progress and significantly limit daily activities, making simple tasks like tying shoelaces or lifting objects difficult or impossible. General fatigue and a feeling of weakness can also accompany arthritis, as indicated by a study conducted by the National Institutes of Health. Fatigue can be caused by chronic inflammation that depletes the body's resources. According to a study published in the journal Current Opinion in Rheumatology, Up to 40% of patients with rheumatoid arthritis experience chronic fatigue. Fatigue can result from both the inflammatory process and the side effects of medications used to treat arthritis. Chronic pain and inflammation can lead to loss of appetite and weight loss, as mentioned in publications by the Arthritis Foundation. Inflammation in the body affects metabolism and can cause a decrease in appetite. Loss of appetite can worsen the patient's condition, as poor nutrition negatively affects overall health and the body's ability to fight the disease. Sometimes arthritis can be accompanied by a low-grade fever, which is the body's response to inflammation. Increased body temperature is a way for the body to fight inflammation and infection. A study published in the Journal of Clinical Rheumatology indicates that up to 30% of patients with rheumatoid arthritis experience periodic episodes of mild fever. This may be associated with an active inflammatory process occurring in the body. If you hear crunching or clicking sounds when moving your joints, it may be a sign of early-stage arthritis. This sound occurs due to the wear of the cartilage that normally provides smooth joint movement. Dr. Mark Johnson, an orthopedic specialist, explains that crunchy sounds may indicate that the joints are starting to lose their cushioning. A study published in the Journal of Orthopedic Research found that up to 50% of patients with osteoarthritis report crunching and clicking in their joints. In the later stages of early symptoms, you may notice small changes in the shape of your joints. These changes may be minor, but noticeable upon close examination. For example, changes in the shape of the fingers or knees may indicate progressive joint damage. A study conducted by the British Medical Journal showed that joint deformity is one of the later but characteristic symptoms of rheumatoid arthritis, observed in 60% of patients several years after the onset of the disease. Gradual reduction in joint flexibility is another sign to watch for, especially if it interferes with performing usual daily tasks. Dr. Sarah Larson, a rheumatology specialist, points out that reduced flexibility results from chronic inflammation and joint tissue wear. In her study published in the Journal of Rheumatology, it is noted that reduced joint flexibility is a common symptom reported by up to 70% of patients with osteoarthritis. This can manifest as difficulty performing tasks such as raising arms above the head or bending forward. So today we discussed 10 early symptoms of arthritis. If you notice one or more of these signs, do not delay your visit to the doctor. Recognizing early symptoms of arthritis is the first step to managing this condition. It is important to remember that arthritis is not an inevitable part of aging. It is a condition that can be managed and successfully fought with the right approach. Besides medical intervention, there are many ways you can help your body cope with arthritis. Regular physical exercise, healthy eating, weight control, quitting smoking, and moderate alcohol consumption all contribute to improving joint health and overall well-being. Remember that your health is in your hands, and only you can decide how to take care of it. Subscribe to our channel to not miss new videos about health and wellness. Take care of yourself and stay healthy.